Good morning. Assalamu alaikum. I'm just gonna wait a few minutes. Is the sound clear? Can you hear me, Sama? Okay. Assalamu alaikum. صوت واضح? Yeah. Okay, تمام. Okay, assalamu alaikum again. So I'm going to be speaking in English just so that it will serve more people. So the purpose I'm doing this live today is to discuss most of the questions I received about postgraduate education, whether my ortho specialty or my current orofacial pain specialty with the US, as well as the program I'm teaching in, because some people are also always looking for opportunities to study and do their dental specialty. So first I'm going to start with my ortho specialty and my journey to be able to study in the US for ortho. And then I am going to tell you about my current orofacial pain, and then I'm going to tell you about the options that are available in Dubai or the UAE in general. So let me tell you my story. So I graduated from University of Jordan, as you know. So back in 2002. So in 2001, I was engaged and I was preparing to move to the US. So I started to look into ways to continue my education, or at least to be able to get my dental license in the US so I can work there. So, of course, the first thing, if you are planning to go to the US, is to do your national board examination, which are, as you know, they are written exams, part 1 and 2. They call them NBDE. So it's kind of, they want to make sure you know the literature and the theory of dentistry. So those are basics. So better if you are planning to go to the US, one way or another, is to take those exams while you are still in dental school, because you are still fresh into the knowledge of, biochemistry and pharmacology and all of this. So this is mostly part 1. And then part 2 is the clinical. So you probably want to be at the end of your dental school, where you have experienced some cases and, you did some treatments, but it's all written. So I did those during my 4th and 5th year. And then I moved to the US. Alhamdulillah, and I was very good student in dental school. I was the second on my batch. Alhamdulillah, I had a good GPA, so I thought things should be easy, like I'm good. But the problem in the US, it's very competitive, and you can imagine how many people come from abroad as international people, as well as you are competing with the local people who are already living in the US. So anyway, anyone who wants to go to the US have to ask themselves this question: am I planning to stay in the US, or am I planning to move back? So if you are planning to stay in the US, you probably want to invest into the time to get your dental license, because without the dental license you cannot practice, even if you did the specialty. This is what happened with me. So if you are planning to stay in the US, you want to look into getting your dental license, so at least you can practice general dentistry. And now there are most of the states nowadays will require you to repeat 2 years in dental school, which they call the international program or something like this. So you have to kind of do 2 years, and then you would graduate, and you will sit for your board exams, which are same like the local people, as if it's a practical on patients, just to make sure you are ready to practice outside, and then you get your dental license. Now, I was lucky because I went to California. So in California at the time, they had an option to take exams, one on the typodont and the other one on patients, where you will get your license by examination, not by repeating the 2 years. And of course, it was very, very competitive, because all the people were applying and you were not getting accepted. Anyway, and I did that part. So I applied for part 3. Now this part 3, so I finished part 1 and 2, the written, And then I did part 3. Now this part 3 was really vicious exam. So they ask you to do 3/4 crowns prep, 7/8 crown preps, onlays and inlays, and they really grade you with a microscope to make sure all the margins are parallel, whatever. And to do wax up and things that I haven't been used to doing in Jordan. At least no one is doing 7/8 crown nowadays. So it was kind of funny. And anyway, I planned and I prepared myself, but unfortunately I didn't pass. And also this was at the same time I delivered my first baby Aya. So anyway, I didn't pass, and then I start to think, okay, maybe I should look into universities and actually, specialize instead of, doing dental license. So I started looking around, and there wasn't a lot of options where I was. So I was kind of like living in Abu Dhabi, and the dental schools were something like far like Dubai. So it wasn't easy for me to even communicate daily. Anyways, so I started looking into the options, and then I got accepted I got introduced to one of the dental schools, and I met the dean and we talked, and some of the schools in the US would have some positions for international students. So for example, if they accept 6 or 8, for example, per year, they would have one spot for an international student. This is their policy. This was at least my university, which was called University of Pacific. Now, if you want to have better chances, probably Boston University in Boston is better because they accept more international students. So maybe you want to check with that school. It's maybe easier because the ratio is better. Anyway, that dean told me, we don't usually accept people like this. We have to know you more, so we would like you to join our the craniofacial genetic lab program, and as a fellow, and during this period we would know you more, and we would see if you fit in our program. So I joined that program where I was doing genetic DNA sampling to study the etiology of cleft lip and palate that they get from samples from their missions to other countries that have a high prevalence of cleft lip and palate. So I used to go 3 days a week, and I managed, and of course I had a child. It was, not that easy to do it. But I'm just telling you these details so that you can appreciate the journey that you have to go through. It's not very straightforward. It's not like you apply to the college and they accept you. You can do that, and you can apply to many, many dental schools, but the chances would be minimal. Because first you are applying from international, you're applying from far, they don't know you. Probably they don't know our dental school. Like, imagine if you hear about a dental school in the middle of Poland, or in the middle of another country. We don't really know what's happening in those schools. Are they good schools? Are they not? So I joined them for 1 year, and alhamdulillah, they were happy with my performance and our communication and so on. And then I was accepted in their program, which is the ortho program. It was 2 years and a half. Of course, we had to move, and there was a lot of adjustment. And the people who live in the US know how far things are from each other. It's not very easy to commute, and I had to take a bus, and then to the metro, and then to the other bus, and then walk another 15 minutes to be able to reach. So I was doing 4 hours of commuting every day with a family, with the kids. So it wasn't very easy. But definitely, it was definitely worth it, because all of this, benefit you on the long term. So during that, of course, we were preparing to take the American board exam. So we took the American board. And by the way, the American board in the US, it's not that valuable. So most of the people are like American trained. So they are not as much valued if they add this to their career. So it wasn't a big deal. But I thought, it will not harm, so I'll just take it. So I took the American board, which is also a written exam, and then you have to submit cases that fit the criteria. In our countries here, in the Arab countries, American board is much more valued. And this was the best thing that helped me when I came to Dubai to get my license quicker and be able to teach and so on. So while you are in the US, really do the most that you can to get as much credentials and qualifications as you can. Much easier, much more useful if you are planning to come back to an Arab country. So with that journey, I finished my ortho program. Now, the funny thing is that I still have to take my dental license. So imagine, I was trained in their program for 2.5 years, plus the year of research, and I still have to get my dental license to do crowns and fillings and so on, even though I'm not planning to do any general dentistry anymore. So my options was to either take the exam that I failed. I actually failed twice in that part 3, which was the typodont prep. And again, I'm sharing this with you so that you know, I mean, it's okay to fail once and twice and to try again. It's not the end of the world. So don't give up if you fail once or twice. Just modify what you have to do and adjust it and learn more and get more qualifications so that you can be better prepared for the next time. Because I know in dental school we have done a lot and we worked so hard, and it is very frustrating if we fail. So that I totally understand, and that's why you know, I want to encourage you not to give up and just to try again. So so my option was to repeat that part 3 again, and khalas, this was the last time they would do it. It will become no more an option for them to take this route for dental license. So I took it the last time, and thanks God this time I passed. And this way I had to take part 4, which was doing real patients, you know, class 2 fillings and perio-scaling and all of that. And then I would take my dental license, and then I'm able to work as ortho. So that is the route for the US. So if you are coming there, you have to do dental license first. The other option would be to do the 2 years, as I said. Now, some states, and if you are living in the US, you need to pay attention to this and read the fine print of the licensing law in your state. Some states would accept to give licensing for people if they finish postgraduate studies and if they just take the patient exam, the part 4 or whatever they call it, Western Regional for examination. So some of my friends who graduated from Jordan and they didn't do the part 3 because they missed it and it wasn't an option, they were able to get licensing by examination, but they have to go to those states. So it was, for example, my friend went to Texas. She did the ortho, and then she did the part 4, and then she went to Texas or Oregon because they accept this type of credentials or licensing. So look into that, fine tunes, and see if that would suit you, because most likely, you know, it's not very easy to move around. And some people, you know, if they are married and their husbands are working in companies, it's not always easy to move around and change. So it becomes more complicated. So this was the journey I had in the US for my ortho specialty. Now the funny thing also, that after all of this journey, it was 2008 by now. So it was 2008, and the economic crisis hit so bad in the US. So I was happy, I finished my studies, and finally I have my dental license, and suddenly everything fall apart, and people were not hiring actually anymore. So people were not hiring, you know, associates to work with them. I was still fresh grad. And again, I'm a Muslim. I am, you know, I have the scarf and the hijab, so not the best fit to be joining an American practice, let's say. So everything was against me being there and continuing or finding a job, let's say, during that period in 2008, 2009. And at that time, I got some connections or some, you know, requests from some one of our faculty to that Boston University has opened in Dubai, and they are looking for people to join their program. So subhanallah, it was all made by Allah's will to make this happen. And we were thinking to go back to the Arab countries for the sake of the kids and all of this. So because I had the American board, I was qualified in the terms of the law here to come and teach in the university, in Boston University in Dubai. It was open here in 2008, I believe, but unfortunately it closed in 2012 due to, again, economical issues and so on. So I joined Boston University I joined as a chair and director of the program while I was still barely graduated. But I guess this was Allah's will for me to start my teaching path. And of course I was, just recently graduate, recently trained. I had 5 students at the time. There was no other faculty with me. It was a transition. So I had to deal with it and start to teach them whatever I know. So I, of course, got, the books and all the resources I could get to be able to teach them the best I can. And alhamdulillah, it was a really nice journey because through teaching you learn. And I learned a lot through that journey, as if I did my residency again through teaching. Because I spent 3 years with Boston University at the time, and it was really, really excellent experience for me. Now, after I finished with Boston, Boston closed in 2012, unfortunately, and there was another dental school that is related to Nicholas and Asp chain of clinics, if you know them, here in Dubai. He has an educational section which is called European University College. So that college, so I was during a transitional period, what to do. So I joined the private hospital that I'm currently with, the American Academy of Cosmetic Surgery Hospital, as an orthodontist. But to be honest, I didn't find myself in this. I didn't find myself just after 3 years being full-time faculty. I didn't like that being full-time in the clinic, just private. So I was seeking opportunities to do some teaching again. And here in the UAE, if you want to do postgraduate, you have one of 2 options. Either to join that university, European University College, or to join now, there is a new university that replaced Boston University, which is called MBRU, Mohammed bin Rashid University, which is both of them are located in Dubai Healthcare City. So if you are looking for opportunities here in the UAE, these are your 2 options. Now, MBRU, because it's kind of semi-government, so their fees are usually less, maybe significantly less, and our university is more private, so it will be a bit more expensive. Now, always the question, and some of the questions that I got is, will I be able to practice after I graduate from this type of program which I'm teaching in? Now, the law here in Dubai says if you graduate from the university as an ortho specialist, you have to practice 3 years under supervision, meaning you have to practice in a clinic that has an orthodontist for 3 years, and I believe that orthodontist has to give you a letter that you were under their supervision or they were around, and then you would be able to apply and get a specialist license. In the meantime, you can still practice general dentistry, but if you want to practice orthodontics, you need to have an orthodontist around or whatever specialty you are doing. So your options, again, for the people who ask me what can I do in the UAE, your options is to either join the ortho program at EUC, European University College, and maybe if I have time, let's say next Monday, I'm going to do a live inside the college so you can get a feel how it looks like, what we do. So currently we have 30 students that are doing orthodontics throughout the 3-year program. It's a 3-year program, full-time program, where you are doing didactics plus clinic all the time throughout the week. Now, of course, if you would like to continue your general practice, whatever time you are free, you are more than welcome to do that. But it is pretty, time-consuming program. So you might want to balance it if you can. But we have some students who are still doing they're maintaining their clinic with it, but it becomes challenging for them and tiring as well. So in our college, we only have ortho currently. We used to have other specialties, but now we are only ortho program. In the MBRU, you have other programs. You have pros, perio, I believe, endo, pedo, and ortho. So you might want to check both of these colleges and see what are their requirements. Definitely IELTS or TOEFL is usually the basic of their requirement, as well as other things that you can communicate with. So this is your options in the UAE. Now, as I said, in terms of licensing, usually this is what frustrates the student, is that, oh, I have to still be under supervision. And I believe also those finishing undergrad, they still need to be in internship and do this type of kind of training. And this is usually where the frustration comes for all the dental new graduate, whether from undergrad and postgrad, like after we have spent that much time and money into this specialty and still we are not feeling recognized or feeling appreciated for what we have spent. Yes, that is the problem. Like for dentists, unfortunately, I guess there are too many of us, and all the licensing boards are trying to limit the number of people who can start to work in the in the country. So they usually make strict education and strict kind of rules to be to keep it in perspective of how many dentists should be practicing at one time. So my advice for any dental student or who just finished undergrad or even postgrad is to really look into developing yourself during those years, whether you are doing internship, observing in any clinic, just shadowing any doctor, because from looking at cases you learn. Some people go into the sales also. Some people, just decide to take this route and do the sales. Some people decide to, like in the US, for example, some of my colleagues who went to the US and they were not able to either afford being in a 2-year international program, or they couldn't for one reason or another. They used to work as dental assistants, believe it or not. After you have finished 5 years of dental school, you go to the US and you work as a dental assistant. Still they are paid. Of course they are frustrated because they are now at the other end of the dental chair, just doing suction and things like that, but at least they are seeing cases. So my advice to all the new generation and the new graduate is really don't look at it with kind of like with some kind of ego, like, oh, my ego doesn't allow me to do this, I am above this, I am a dentist, why should they keep me as a dental assistant? What is your option? You either stay home or you do your dental license. Yeah, exactly, Dalia. You learn a lot. Just be around a dental office. Really, I would recommend to be around a dental office, because you really, really learn a lot from cases, more than you would learn from theory. So that would be an option. I know that some people would say, but we want to be paid, we have to pay off our loans and all of this. All of this I understand. So look at your options, but don't let a lot of time pass while you are doing nothing related to dentistry, because we lose it. We lose the knowledge. We lose it if we don't practice. So if you are finished from undergrad, you are still a fresh dentist, I would recommend either look into a specialty program if you can afford the time and money and you are accepted. Of course, if I would say, if you have opportunity to go to the US, definitely go to the US. I'm not very familiar with the UK and the Europe, but if it is not that easy, but I don't want to put you down, try and have your own journey and have your own connections. If you know people, that usually helps. If you are accepted in a program that you like, that would be perfect. Go ahead for it. If you can't, for many reasons, and now there are a lot of political reasons as well, and some nationalities cannot go to the US, etc., then consider some programs here in your home country. I don't know where you are from, consider some of those. If not, then consider at least some intensive education in the specialty you like. So if someone likes endo, there are a lot of courses that are around endo that happens around the world. So, and you can learn a lot from them, and kind of, you don't necessarily will become a specialist, but you will be doing this more at a higher competent level due to the good courses that you can take, and then you can focus on them and build a career around it. If not, then at least shadow a doctor or be around them to learn from them all the tools, tips, and techniques. And you know what? When you expose yourself to clinics and offer them some value or some help, you become known, and then they maybe hire you, and then maybe they will recommend you to another clinic. You know, just I usually call it add value for yourself. Then you add value for, if you give and contribute to some clinic and show them what you know and how much you care, most likely your name will be recommended to other people. If not, that same doctor will hire you. So that would be my recommendation. Now, of course, the cost issue is a big problem. At my time, and we are talking about 2000, when I was accepted, it was 2005. So the ortho program at the time was around $50,000 per year. Now, I hear now, and this is after 14 years now, I hear it's around $100,000. So it is a lot of money. So also be prepared for something like this. And usually the US system goes with a lot of with loans. All the students in the US take loans all the time. So people would take loans, and then they would spend the rest of their lives paying off that debt. So that is an option. I mean, just to give you an idea of how much the cost is. Some schools are less expensive than others. Usually the less expensive schools are more competitive because more people are applying. But trust me, it is very competitive even for other specialties and even for the expensive one. Because it seems to me that now general dentists kind of like, they feel like a general MD. So they feel like, you know, it's just the first part. We still have to do our next part. So that would be my recommendation. Now, for the people who asked me about the orofacial pain program, so this program, and later I will put for you the link, and I have previously talked about it in my story, and I saved it in the highlights under USC, so you can go ahead and kind of get an idea about it. So this is a program that is hybrid between online and real, you know, between online and traveling to the US. It is located in Los Angeles, again in California, but southern part of California, where I go once or twice a year to attend the clinic, and the rest is all online. And I talked about it in the highlights, and it is a very intensive program where, you know, you have to watch a lot of videos and do a lot of quizzes, and there are some live sessions every week to discuss cases and things like that. So it's a really nice program, and they offer different specialties like orofacial pain, oral pathology, radiology, geriatric, I think community health, things like this. Now, some people ask me whether you can get the board exam if you do this type of study, or be American board. Now, you have to ask exactly about the specialty that you are interested with. Some specialty will have an American board entity that will examine you and give you the American board based on that, while others do not have. So you have to contact the school directly and see if they have an American board that is related to this. Now, in orofacial pain, they have an American board that you can apply to, and this is what I'm doing. So I initially joined as a certificate degree, and then I found out that if I want to take the American board, I have to be in at least 2-year program. That's why I switched from orofacial pain certificate to the 3-year program that's orofacial pain and oral medicine master degree in order to be able to take the American board. Because from my experience with the American Board of Ortho, that it usually gives more value, more credentials, and kind of, you know, it's more better qualification. So I finished, again, they have a written part and an oral part. So I finished the written part in last year, and inshallah this year I am due to take the oral part, bi'Iznillah, and then it will be over. So if someone wants to have some kind of American board thing in their qualification, maybe they can consider something like this. Now again, we go back to the same idea. Can I do my license if I take this? No, you cannot take your license if you do it. Licensing is a totally separate story from credentials. So in the US, there is only general dental licensing. That's it. So if you are general dentist, you can do anything. They don't even limit you to do ortho, endo, implant, whatever. If you think you are qualified, you are, you know, allowed by the law to do whatever you want. Unlike here, for example, we have specialists like ortho cannot be done except from orthodontist. So that is what I wanted to say. This is what exactly I wanted to say to you all. Yes, some people also, there was a question about, what do we call it, residency visas and, you know, permanent residency visa in the US. Someone was thinking if they have the green card, then they can practice. Immigration issues are totally irrelevant to, licensing. They don't care. Even if you are, you know, illegally, you know, coming from Mexico, you can still get your license. They don't look at these things. So licensing has to come through the pathways of licensing. Either you do it as, like I said, 2 years, either you do a specialty and you apply to the boards and move to the areas that would allow something like this, or if you are going to be teaching in university, you can get a faculty permit, which can be also an option if you are into the teaching. So that's why I wanted to make this video, to kind of broaden your spectrum about what is possible, because from my experience and from my communication with all the dental students over the years, I know the frustration they go through. Yani sometimes you feel, why did I become a dentist? Like everywhere I have to travel, someone will ask me to take my exams again. Like exams, like even some of my colleagues who are in their 50s or 60s, they cannot move around, let's say, with their families to Canada or the US if they're applying for immigration, because they cannot practice there. Imagine someone who has been practicing for 20 or 30 years still have to sit for the examination. So sometimes really you think, like, why did we study dentistry? Because we are living in an area where everyone is moving around constantly. So you would like to be able to move and work without all of this hassle and the need to comply and prove that you are able to practice. That's from our side, this is what we think. Of course, from the licensing board, they are thinking we need to make sure that these people are qualified to not mess up with our community. Of course, I understand the both sides of the value of the story. But yani, sometimes you think, I wish if I was like an interior designer or like an engineer, where I can move around from one country to the other and just work, because mainly with ladies, and sometimes they get married and they don't know where their husbands will be, so they end up moving around with them. And if their husbands move around from one country to the other, they get stuck with this, you know, a cycle of everywhere I go I have to do licensing, and many times it takes years. Like some of my friends in Canada, they took 2 to 3 years just to do their dental license. So that is a problem. Now, another advice I want to tell all the new undergrad student, as well as mostly undergrad, try to increase your value. What do I mean by that? I mean, try to do research while you are still in dental school. Jump on any opportunity of research. Jump on any opportunity of community service. jump on, any extra work, extra courses, extra education, extra credentials in your CV. Because nowadays, universities are not only looking at credentials in terms of GPA and your grades in, let's say, in dental school or the degrees, whatever. Most of the universities, their criteria for acceptance is looking at your whole portfolio. So they want to see what is your GPA, yes, what is your grades in, let's say, TOEFL, and if you are in the US, the national board exam, how much you got. All of these are important, but this is only one part of your application. The rest of your application that they review, and I was involved in this now that I am teaching myself, and we review applicants as they come. We also look at their research experience, because if you are going to join a postgraduate program, eventually you need to do a master thesis. So they want to know what are your skills in master thesis research. Do you have any background in research? Do you have any papers published? Do you have any skills in terms of computer and writing skills? So that is also very important, mainly for the Arabic, English as a second language. Usually most of the students suffer with writing. And I myself had this problem when I was a resident. English wasn't my first language. I studied my high school in Jordan, where we studied all in Arabic. So it wasn't easy for me to write fluently in a scientific language. So I would recommend to invest in increasing your skills in those dimensions as you are preparing yourself to apply for universities. So get some research experience, really stick to any of your faculty who's doing anything, even if you work for them for free, if you offer to do data entry, if you offer to do anything, just stick yourself with some experience in research. Really, really helpful for all the students who apply. As well, as I said, get some courses in writing, scientific writing, even the grammar, the proper writing, the proper punctuation, and all the details of how to write properly. PowerPoint, because most of the residencies require a lot of presentations where you have to present your cases, where have you present your thesis. So become comfortable with those skills of writing, computer skills, and presentation skills. So become comfortable to be able to speak in front of people, to present, to, also to take photography classes if you are in dental, anything related to dentistry. Now, as we know, it's mostly about picture taking. So also invest in yourself to be able to take, for example, proper photography classes or equipment to have proper pictures, whether you are going to be in general or whether you are going to join a program. So all of these things really, really help. What else? Nowadays, even I heard that not only for in the dental field, even now when they are looking at the high school, if they are looking at the high school students getting accepted in the universities, let's say in the US or even here, they are also looking at their community work. They want to see that this person is a well-rounded person, that this person is, not only they are good, they got good grades in their exams and they are good students. They want to see that they are involved in the community, that they are, providing help to other people. They want to see their personality, basically. So even if you have kids now in school and high school, make sure you invest in them to make them join other things to do in the community. And even to have hobbies and to have some, impact in their neighborhood and be useful basically to the community. This is what universities are mostly looking for nowadays in applicants, because we are becoming many and the competition is really, really high in any university, in any specialty. It's becoming very hard for people to be accepted. So you need to raise the value of your application by doing all this stuff and show, the impact you do. So some people would have like a charity work, or they joined, a volunteer like mainly our kids, if your kids are like teenagers, make sure you involve them in something like this, because it is very helpful and useful for their CV, as well as to really make them more rounded. Because as you know, and as we speak, most of the time we get our experience from talking to other people and from being involved in the real world, rather than just sitting behind the books. So that's another thing that I would recommend to all the students, is to really invest in your other skills, so that you become more rounded, you become more competitive. Of course, they like usually years of experience. So usually a classroom would have some people who are fresh grad from dental school that got immediately to specialty program. And they also like to have a mix of older kind of dentists that have been practicing for years, to give a perspective in the classroom itself. So they usually like this mix. This is what I saw at the other side, where we are talking behind the scenes of how we accept applicants in the room as they are all done with their interview. So usually they like this mix. So if you are a dentist who have been there for like, I don't know, 5-10 years, don't think you are old, that it's too late for me to get in any program or to continue my education. Some of my colleagues, and when I was a resident, were really with 15 years of experience. So it doesn't really matter. They used to bring a beautiful perspective when we were discussing cases, mainly like multidisciplinary cases, or from their experience about crowns and implants and the details of, you know, surgical, and whether this is difficult or easy. So it added up to the classroom discussion. So that is also what they look for: years of experience, research, skills, and community work. So these are the things I think I wanted to discuss with you, and most of the questions I believe I have answered. If you have any questions, let me know. Do you recommend any online classes? Wallahi, in writing, I don't recommend one per se, but definitely if you look around to see if there is any like scientific writing courses or things like this, it's probably can be helpful. I know Udemy, Udemy. It's an online platform for education, and I believe a lot of courses are offered there, so you can kind of look around and have a preview of some of them and see if that helps. So that can be an option. Please save the video. Yeah, inshallah I will save it, and inshallah I'm planning to upload it on my YouTube video, on my YouTube channel, so that it can be a reference for most of the students as they graduate. And then I am studying in Taiwan, and I'm going to take the national exam. Will it be valuable as the American in Arabic region? Yeah, definitely. Always add to your credentials. Really, add to your qualifications. It doesn't harm. If it doesn't good, it doesn't harm. And you know what's the funny thing? That regulations keep changing all the time. All the time. Now, like recently, I came to know that one of our current students, he was orthodontist from, what do we call it? From Austria. Austria used to offer people, I think, specialty through an easy way of kind of observation or doing cases in a different way than a full-time program. So initially they were approved to practice as orthodontists here in the UAE, and now they decided that those people are not qualified, so they took their licensing from them. Imagine. So always aim to get the highest degree of credentials, really. It doesn't harm. Any more examination will help. You know what it will help with? It will help to make you more strong. Anytime you take an exam, because the way we study for exams is different than the way we study for or read any article or read anything, we come across it, or attend, let's say, a CME course. It's different when I am studying and I'm preparing and I'm looking at my cases and making measurements. Maybe one day I will share with you the American board ortho exam details, because really that exam, when I had to apply the 6 cases, I need to grade myself and look at the details. It has taught me tons. Although I had already been taught in this university in the US, which was a very good program, but still going through the examination and doing your own self-assessment on details, it added a lot. I become more detailed. I become more critical of things, which other people don't see it. Like, people see the bigger image. And because I needed to grade myself up to the 0.5 millimeter, I become so detailed. So that added more value to what I do and to the details of how I finish things. So anytime you take an exam, don't look at it as a burden. Really enjoy it and enjoy the experience, because with every exam, we really grow, definitely grow a lot, and become better as clinician. Because at the end, yes, the qualification and the title is important, but the most important is the content of you, what you know, what you can offer your patient. That is more important than just the title, although of course the title is extremely important, as I said, mainly here. So for the person who asked from Taiwan, definitely go for it. As I said, if it doesn't harm, it will. If it doesn't help, definitely it will not harm. And sometimes you might go to another country, and all what will save you from taking more exams to get your license is this qualification, for example. You never know. Just do it. Just do it and go with the flow and invest in yourself as much as you can, and keep learning and keep enjoying the learning, because really I feel this is the best thing in life. So I think I am done, unless we have some more questions. Thank you, Dalia, and thank you, Ola. I hope this has answered some of your questions. I know some people are probably in other parts of the world and they couldn't attend the live, but I hope I have answered their questions as well, and they can see it at a different time. So I'm just gonna spend 1 more minute for any last question. Okay, so I'm going to end it now, and I will save this inshallah for 24 hours, and I'll try to upload it on my YouTube. If any of your friends are interested, they can listen to it and scroll through it to whichever part suits them better. And if you still have questions, you can contact me anytime. And if it is a lot, then we can have another live video. But inshallah, there will be more live videos about other topics that I also feel is useful. And inshallah, maybe I'm going to take you in a tour in the European University College, probably on Monday, and I'm going to show you even the way in Healthcare City and inside the college a little bit for those who are interested. Okay, have a lovely day, and inshallah talk to you later. Assalamu alaikum.